The health department is sounding the alarm over the rise in HIV cases and urged the government to declare it as a national public health emergency. The DOH recorded a 500% increase in HIV cases, particularly those aged 15 to 25 this year alone. What should we know about HIV and AIDS? Joining us live via Zoom is Dr. Chester Tongco from the Quezon City Health Department. It's a beautiful day, Doc Chester. Welcome to the show.
Thank you po. Good morning po. Good morning.
Doc, nakaka-alarma talaga yung numbers, no? 500% increase and young generation pa yung karamihan nitong mga HIV-infected individuals, right? Cases. Now, let's start the interview by first distinguishing ano ba nga ba ang HIV and ano ang AIDS. Let's differentiate those two.
So, first of all, HIV is a virus that causes HIV infection, while AIDS po is the last stage of HIV. So, AIDS happens when hindi nag-treat or hindi nag-take ng antiretroviral medications yung isang tao and hindi na po niya kayang labanan yung mga opportunistic infections like TB, pneumonia, bacterial meningitis. So, yun po yung pagkakaiba po nilang dalawa.
Nakita natin na medyo tumataas na talaga yung mga cases ng HIV dito sa Pilipinas. In particular, the DOH did mention, as we said a while ago, that they want this to be declared a national emergency, a national public health emergency, rather. 5,101 cases recorded from January to March alone this year, an increase from 3,409 cases from the same period last year. There are so many people online trying to figure out bakit tumataas yung HIV cases natin. But then let's talk about first how alarming it is na nag-i-increase at this particular rate, Doc. Is it a big surprise in your opinion, or was this a trend that we've been seeing in the past na talagang umaangat or umaakyat talaga yung rate of HIV dito sa Pilipinas?
Personally ako, hindi siya big surprise for us kasi I think the main reason why tumataas din yung trend is because of the effort of the health department. Kasi our testing, mas madami na kaming na-test po ngayon na cases. So I think it is partly a contribution to why there is an increasing number of data.
So, Doc, just to be clear here, it's not just the fact na it's actually better identification and better reporting. Is that one of the reasons why you feel na tumataas yung numbers natin?
Yes. Kasi in the past few months, sobra yung testing namin, sobra yung paghahanap namin dun sa target population, which is yung Gen Pop or yung Gen Z Pop, yung Gen Z na population. So I think yun talaga yung parang pinaka main factor why it appears na parang mas madaming cases po ngayon.
Doc, can you tell us ano nga ba ang signs and symptoms of HIV infection? So how can you tell if you have the virus?
Signs and symptoms, so usually the person experiences body weakness, fever, cough, colds, fatigue. Pwede siyang magkaroon ng mga cervical lymphadenopathies or parang kulani sa neck. Rashes sa katawan, pwede din po yun. Yun po yung some of the signs and symptoms of a person with HIV.
Some patients would say na they don't feel anything naman, so they don't have the need to get tested. How frequently ba dapat, Doc, should the patients be tested? And even if wala ka nung symptoms na yon, should you go and have yourself tested?
Yes, actually, it really depends on the person. Kung alam niya na meron siyang risky behavior or if the person engages in promiscuous sexual contact, dapat yung that person already has an inkling to have it get tested. And Usually, the testing is done 3 months from your last sexual contact. So, every 3 months siya. So, ay, ayun to. Mm.
So every 3 months, of course, some people are wondering, how do you get tested? What's the reliability of these tests? For those wondering, you mentioned there is an increase in testing in general. That's why there's an increase of reporting as well. What are the ways people can get tested, and of course, how do people access this typically?
Well, in Quezon City Health Department, we have 9 social hygiene clinics and clinica all over QC. So they can just walk in whenever they want. So for the social hygiene clinics, they're open from 8 to 5 p.m. every day, Monday to Friday. And for clinica, like where I belong, we are open from 3 p.m. to 11 p.m. So everyone is welcome to come, male, female, transgender, yun, they're free to walk in. And testing is free, treatment is free as well.
Yeah, just so for those people wondering, is it a blood test, or at least in terms of like having to draw blood? Kasi mayroon takot talaga sa mga needles in general.
Basically po, it's like a rapid antigen test kit. So it's a blood test. Pero prick lang naman siya ng finger. So we only need a few amount of your blood by pricking it, and then we're going to put it sa testing kit, add dilute it into it, and then after 20 minutes, pwede mo na malaman kung positive or negative ka for HIV.
You know, Doc, Paolo mentioned that may mga takot sa needles, kaya medyo hesitant to take the test, no? But aside from that, meron kasing stigma. You know, when you
Yes.
when you talk about taking that HIV test and then waiting for the result kung positive or negative ba, and then and especially now that young people yung karamihan ng mga HIV cases, right, they're afraid of people judging them yung pagpunta mo pa lang to take that HIV test. Are there any measures being done to create a more accepting environment ba? Yeah, para doon sa mga gustong magpa-test for HIV?
Yes, kasi in our facility, or in all facilities of Quezon City po kasi, everyone is trained. So we have HIV counselors, case managers, we have peer educators who are all trained in mental health. So para hindi matakot yung bata or yung person na magpapatest. So as much as possible, pagpunta nila sa clinic, we're trying to create a safe space, and we try to prime their minds na it's okay. It's safe to get tested in our clinic. Kasi parang all the information that you are going to give to us is private and confidential.
Doc, let's assume someone does have HIV, and of course, people are wondering, how do you even treat HIV? May iba doon takot kasi kung nalaman nila may HIV sila, they have to go through the treatment.
Yes.
May mga ganun, which is obviously a few problems with that line of thinking. But in terms of treatment options and of course mga potential side effects, how does a treatment cycle go for someone who is positive for HIV?
So the treatment for HIV is called antiretroviral medication. So for now, yung pinaka-common is yung 3-in-1 antiretroviral combination siya. So you only need to take 1 tablet every day, same time each day. So hindi na siya ngayon parang death sentence eh. It's more of like you need to take the medication, para na lang siyang supplement or para na lang siyang vitamin that you need to take every day. Pero ang pinagkaiba lang, you need to be adherent to it, you need to be compliant to it, na hindi mo ma-miss yung dose na pag-take mo.
Doc, nakikita natin here on our visuals, there's this PrEP and PEP. What is that all about?
PrEP is pre-exposure prophylaxis. So may 2 kinds po nito. So it can be daily or event-driven. So PrEP is a pre-exposure prophylaxis or prevention for HIV. And PEP is post-exposure prophylaxis that you take for 28 days, one tablet every day if you are exposed to possible HIV exposure. Pero as of now, we prioritize dun sa mga occupational siya. So, yung mga nurses or healthcare workers po na prick or na exposed to possible HIV infection.
How does being positive for HIV affect someone's lifestyle? What adjustments do they have to make when they find out they are positive for HIV? And of course, for those who actually are, concerned of like when they find out someone has HIV, what are the myths siguro that we can debunk when it comes to dealing with people or at least interacting with people who are positive with HIV?
Some of the myths is yung parang pwede mo siya makuha through kissing, through saliva, sharing of spoon and fork, hugging, mga ganyan. Kasi syempre, hindi mo nakukuha yung HIV through that, di ba? You can only get HIV through possible exposure to blood, semen, sharing of needles, and from mother to child or vertical transmission during pregnancy or through breast milk. Yeah. Yes.
Doc, if there are people out there, maybe a young person who has questions or concerns regarding HIV and natatakot silang to go out there and ask because of yung stigma nga and yung confidentiality issues, meron ba mga support services that are available for HIV patients?
Yes, they can contact our Facebook page. Sobrang we are very responsive to it. Or they can contact CESU or the epidemiology unit of Quezon City. I think other cities also have it. So sobrang accessible na siya ngayon as long as the person is ready to take the action. Kasi hindi naman namin pwedeng pilitin yung tao eh.
Right.
Kasi what happens nowadays is they get scared. Usually may cases na they block us kaagad. Pag nalaman nila na positive sila. So as much as possible, we try to motivate them na kailangan mag-start ka na maggamutan in order to prevent it from advancing to AIDS.
Thank you very much for joining us this morning. Such a good conversation with you, Doc Chester Tongco from the Quezon City Health Department. Thank you, Doc.
Thank you. Thank you po. Thank you.
Maraming salamat, Doc. Really appreciate you